All right, guys, we're going to pick up where we left off talking about the cervical vertebrae. Cervical vertebrae are found in the neck. If you've ever watched a medical drama and they ask for a C collar, that's what it's referring to, is a collar that stabilizes the cervical vertebrae. A lot of times during a traumatic event like a car crash, whiplash will occur and it could damage the cervical vertebrae. If something happens to the spinal cord in this region, stabilizing it will help to not further that damage. When we're looking at cervical vertebrae, something that you'll notice is that they are very small and dainty. And they also have these transverse foramens. They have these little holes. These little holes are actually for the cranial nerves, which are the first nerves that come directly off the posterior aspect of the brain. So they're the only vertebrae that have these little transverse foramens compared to a thoracic vertebrae, which is much heavier and bigger and does not have those little holes in it, okay? So whenever you see those transverse foramen, you know you're looking at a cervical vertebrae, but really just the size. They're the smallest vertebrae. They're at the top of the vertebral column, and they have the least amount of weight to support. One other interesting part about cervical vertebrae is that we have two that are very, very unique. C1 has a name called atlas, and C2 is called axis. So these two vertebrae, here you can see atlas and axis, their main job is to articulate like so, and to give good movement for the skull so that you can turn your head kind of 180 degrees from left or right. You can look up or down. You can tilt to different angles. So if you don't know the Greek myth of Atlas, he's the guy that you often see kind of crouched down with the world on his shoulders. That's Atlas. Okay, so he holds up the world and is responsible for the world turning or whatever. So Atlas holds up the brain. Okay, he holds the brain or your skull on his shoulders. Axis is named because of this little dens, this little kind of pin that sticks up and articulates, and that's what allows for the greater range of motion between C1 and C2. The rest of your cervical vertebrae are just small and dainty. They sometimes have this forked or bifoid spinous process that sticks out the back, and of course those transverse foramens we already talked about. As we go inferiorly, we have our thoracic vertebrae, which are quite a bit bigger, and they're just your typical looking vertebrae. They will have a spinous process sticking out the posterior side, transverse processes sticking out laterally, and of course that passageway, that vertebral foramen. They also are going to have little tubercles for rib attachment. So you know it's a thoracic vertebrae if it will attach to a rib. So you can see the articulation from T1 to T12. Those little demifacets for the rib articulations are present as well. And then we get to the big boys, the lumbar vertebrae, which are huge, especially compared to our teeny tiny cervical vertebrae. They're the largest and the strongest because they have to support all the weight of the vertebrae above them. Their spinous process is not quite as long, but they do have very bulky transverse processes, and the vertebral foramen is still present. The way you can tell you're looking at a lumbar vertebrae is because of the very large and thick vertebral body. So here we can see the side view of a typical lumbar vertebrae. And you can see really when we compare all three of them, the cervical to the thoracic to the lumbar, they get bigger the more inferiorly you go on the spinal column. Remember, they're all kind of stacked up on one another. The cervical vertebrae, we have that bifoid spinous process. We have the additional foramens. Thoracic, we have the rib attachments. And the lumbar are just really, really big. So the last part of our axioskeleton is a couple other random bones. The sacrum is actually a bone that is the base of your spinal column. So the last of the lumbar vertebrae is kind of just sitting on top of the sacrum. Okay, and the sacrum itself is actually formed from fused vertebrae. So you can kind of see how we still have some of those structures that we saw in a typical vertebrae, but they've been fused together. The coccyx is the tailbone, so it's this little inferior portion of the sacrum, and it's actually four teeny tiny vertebrae that are fused together. The coccyx really doesn't serve any purpose that I'm aware of. I suppose it could be anchoring a few of the muscles, but the sacrum really performs most of that process. You can see it does have a little curve to it. It'll be different in males versus females, but the sacrum is just going to anchor and support the entire vertebral column above it. Then if we go back up to the thoracic cavity, we have our sternum. So our sternum is our breastbone, so it's kind of sitting like so. You can feel some of these little notches on your own sternum. You can feel this little notch right in the middle, right here, and it will actually articulate with your clavicle. Your clavicle is your collarbone, and it will just attach right there. The sternum itself has three parts. The manubrium is this top part, then the body, and then the xiphoid process is this little triangle at the bottom. The sternum's main job is to anchor and attach the ribs. The ribs will attach to this cartilage. So this clear stuff attached to the sternum is actually just cartilage. And so the ribs will attach to them, and then the head of the rib actually attaches to a thoracic vertebrae. So it creates a one continuous cage, a literal rib cage, to protect the heart and lungs. So our ribs can be named according to if they truly connect to both the sternum and a vertebrae, they're called true ribs. If they still attach to the sternum and the vertebrae, but it's only a secondary connection. So the five inferior pairs, 1, 2, 3, 4, 5, have kind of this extra little jaunt or jog. They are called false ribs. And then the floating ribs are ones that don't actually connect to the sternum at all. So if you look really carefully at this inset picture, you can see these two pairs of floating ribs, that they're anchored to the thoracic vertebrae, but they don't actually connect to the rib or to the sternum itself. You can also see here some of the surface markings. That suprasternal notch is right here. You could probably feel yours. The clavicular notch, you'll have one on each side that will articulate with your collarbone or clavicle. Those are both part of the manubrium. Then we have the body and that little xiphoid process at the bottom. Here's a typical rib. The head isn't as prominent as on other bones like the humerus or the femur, but that is the portion that will attach to the vertebrae. Okay, and the facet will go to that cartilage. We call that the costal cartilage that's attached to the sternum. So there are a couple disorders that you may want to be aware of in reference to the axial skeleton. Probably one of the more common disorders is issues with your back. A herniated disc is when those little cushions between your vertebrae end up getting ruptured, or they kind of pop a little bit because they're kind of filled with this fluid because they're mostly connective tissue. Sometimes that supporting tissue, if it gets squeezed or squished, or you get some type of trauma to it, it can almost pop out, almost like a little, well, that's what a hernia is when a structure kind of pokes through something it's not supposed to. And that can cause nerves to get pinched, which can be very painful or cause numbness. So herniated discs can often only be treated with rest or potentially an adjustment by a chiropractor. But they can require surgery if they get really extreme, but oftentimes just rest and some steroids to reduce inflammation will do the trick. Another disorder is called spina bifida. I know one of our groups had a term project on this. I can't remember which one, I apologize. But this is an inherited or congenital defect. Well, it's not inherited, it's a developmental defect. So it happens during pregnancy. We're not exactly sure why, but for some reason, this vertebral arch doesn't close up all the way. And so part of the spinal column is actually exposed. This can be really dangerous. The next slide is a little bit of a graphic image of a baby with a very severe form of spina bifida. So what you're seeing here is actually the membrane directly surrounding the baby's spinal cord. So exposure to the spinal cord is very, very dangerous. And so oftentimes they will do surgery to seal this up and to protect it and to make it a little bit safer. Most of the time, children with spina bifida do just fine. They might have some numbness. Really severe cases like that picture, they may end up paralyzed or in a wheelchair, but oftentimes that's not the case with modern medicine. It usually can be corrected or it can be fixed. Okay, so that wraps up chapter 7 about our axial skeleton. The axial skeleton's job is to protect your very delicate organs, including your brain and your spinal cord, the heart, and the lungs. The bones can be categorized into different shapes based on what they look like and their jobs. And we also talked about the general surface markings of bones as a whole. So please make sure that you've turned in your chapter 7 homework. Hopefully you did the NASA article, read through that article and answered the questions with a partner. That can also be turned in the hand-in box for period 3 or uploaded onto Buzz for period 7. And you can continue to work on exercise 5. The due date for exercise 5 is Thursday, October 28th. And we will have our lab quiz on Friday, October 29th. So those are just some dates to keep in the back of your mind. All of this should also be on Schoology or Buzz, depending on which class that you are in. Have a great day, everybody, and we'll see you soon.